Hi there, today I'm going to talk about the signs, symptoms, and survival rate of prostate cancer. Now, I will advise you to watch to the end because this is very important, especially for men, and especially for men over 50 years of age.
Welcome to Medicwithoutjargons.
And so, prostate cancer, I'm going to talk how to go through the things, the key topics I'm going to talk about. The first one is, who does it affect? The second point is that what are the symptoms of prostate cancer? And the third thing is that what are the treatment options you've got? And finally is what are the prognosis? In other words, what are the chances that you're going to be okay if you're diagnosed with prostate cancer? So let's get into it. So number one, who does prostate cancer affect most? Or who has a chance of, having prostate cancer? The thing is that if you are a man over 50 years of age, it doesn't matter whether you're black or white, you have a chance of having a prostate cancer. Because the older you are from 50 years going forward, the chances are there. Also, if you're a man of black origin or African origin or Caribbean origin, your chances of prostate cancer is also very high. And this is very important. So if you're a man, just whether you're young and you're watching this, talk to your brother, talk to your dad, talk to your uncle, talk to any person you know, especially if you're a black person. See, this is one of those cancers that it seems to be ignored or silent. And also it is quite prevalent. The unfortunate thing is that, men, we hardly go to the doctors. But this is one of those cancers that if spotted early, it can be treated, it can be stopped in its track. And so that's why it's important. And so if you're a man and if you're over 50, if you're black origin or Afro-Caribbean origin, then this is possible that prostate cancer is something that you should be thinking about and worrying about. And like I said, you shouldn't worry about it really, so far you are aware of it and you do what you're meant to do. So what are the symptoms of prostate cancer? The symptoms that people begin to get, which sometimes they don't even relate with prostate cancer, is things like getting up to wee more often, or when they go to wee, they never finish it, or they find blood in their wee. When they urinate, there's blood in their urination. Or sometimes they have erectile dysfunction, or when they have an erection, it takes time to get an erection, or it doesn't stay long. Now, these are not things to be worried, to be embarrassed about. Another symptoms are things like back pain or waist pain or pain in the bone. Those are the subtle symptoms that they can get, which could be, there are other symptoms of things like urgency to go to the wee is something you get in a large prostate. So, but you need to know those, or erectile dysfunction is something people get if they're diabetics or if they're on certain medication for diabetes or blood pressure. But the thing is that these symptoms are also available in prostate cancer cases. So these are the things to watch out for. If you're having any of those symptoms, please try and make an appointment and see your GP. And what kind of tests can be done? The tests are not so invasive to start with. Some of them, rectal examination is invasive, but the initial test, which we call PSA test, they are not that invasive. If you're over 50, or if you're worried, or you have a family history of prostate cancer, my advice is go to your GP. They'll be happy to do a PSA test. It gives them an idea. It is not a conclusive test, but the result of your PSA test will tell them, do you have a chance of having a prostate cancer? I will also say that if the prostate PSA test is normal, it doesn't mean, that's it, that's done. My advice is still, please try and go and have a routine test every now and then with your GP. with your PSA, especially as you get older from 50 years old. Constantly check your PSA test, just to make sure. Because the thing about prostate cancer is, as soon as they can catch it early, it can be cured. But if you go to your GP and your PSA test is high, they will send you for a further test. They will send you for what they call rectal examination. They will check more to confirm whether there is a definitive diagnosis of prostate cancer. The beauty about these tests are that the earlier they can do it before you start showing physical symptoms, the better they can catch it early. So my advice is, do not wait for too long. Do not wave it off and say, oh, it's nothing. Try and see your GP and they'll be happy to help. And what are the treatments? Now, again, like I said, the treatment is dependent on at what stage the prostate cancer is caught. If, for instance, you're not showing any physical symptoms and your PSA is high, and they send you for a further rectal examination, and they realize that, hang on, they can diagnose you have prostate cancer, there are options available. They can do surgery, they can also do radiotherapy, they can do chemotherapy, and these, because if they can find it early, they can control it before it spreads to the whole of the body. Bearing in mind that prostate cancer is a very deadly condition. Most people die from it, especially if it has spread beyond their prostate gland. So my advice is, once they have done a test and they go from there and do a rectal examination, they will give you an option. Please do not, wave it off. Do not say, oh, I'll think about it. Just trust what they're telling you. Because if they have found something early, they can do a surgical procedure to cut it short so it doesn't spread out. They can also offer you tests to do a radiotherapy or chemotherapy. But the earlier they cut it, the more localized it is, the better chances of survival. So please do not put it off. And so what is the prognosis? In other words, what is your survival rate? The truth is that if the prostate cancer diagnosis is done early, the prognosis or the chances of survival is very high. In other words, if they can catch it when it has spread beyond your prostate gland, they can localize it, they can do a local treatment, they can even do surgery depending on how far it's spread. So chances of survival is very high. But the truth is that it has to be caught early. So if you're a man, please do not put it off. If you're a black man, please do not put it off. If you're over 50, please, and you haven't done any test, if you haven't done any prostate test, my advice is please see your doctor, see your GP, try and do a prostate cancer test. Also, if it runs in the family, because sometimes these things run in the family. If you're genetically, maybe you have somebody in the family who has had prostate cancer, that's more of a reason why you should be having a test. Now, on a final note, I want people to know that there's a difference between prostate cancer and benign prostate hyperplasia or enlarged prostate. Now, enlarged prostate is common with men, be it white men or black men, where the prostate is enlarged and they normally give you injection to shrink it. Not most of the time they give you medication that you can be taking just to shrink the prostate if it's enlarged. Those are not dangerous, so do not confuse prostate cancer and enlarged prostate. Thank you for watching, and goodbye.